So much of healthcare happens after someone has had something go wrong. But what if more people had support, education, and accountability that they needed before disease became a crisis? Welcome back to the Practice Pulse, where we talk with leaders who are building smarter, more impactful organizations in health, wellness, and longevity. I'm your host, Nancy Margrit, founder of Optima Pro AI, where we help businesses create practical AI systems, operational clarity, and scalable infrastructure while retaining the human touch. Today, I'm joined by Debbie Wright, Executive Director of A Vision of Health. Debbie has spent decades working in preventative health. Before leading A Vision of Health, she owned a mobile mammography company in Los Angeles for 30. She later took a nonprofit that she had started in 2011, which began as a breast cancer prevention program, and expanded that work into diabetes prevention through the CDC's National Diabetes Prevention Program. For more than a decade, A Vision of Health has been helping people make real lifestyle changes around weight loss, physical activity, healthier eating, and turning unhealthy habits into sustainable, healthier ones. Debbie, I'm so glad to have you on the show. Thank you for taking time out of your schedule to be here.
Thank you, Nancy. This is very exciting because this program has been around for a while and it's considered to be rather new. So we're thrilled that you want to talk to us today. Thank you.
Yeah, absolutely. So let's talk a little bit about that. You spent 32 years in mobile mammography in Los Angeles before moving deeply into the nonprofit prevention work that you currently do. What first pulled you into preventative health?
Well, I've been working with the American Cancer Society for almost 40 years as a volunteer. And one of the things I loved about the American Cancer Society is they really believe in prevention. And we're preaching all about the concept and the idea, don't eat sodium nitrites, for instance, and exercise is really important, physical activity as well as food is medicine. The research definitely has panned that out for us. The CDC has proven that prevention really is the answer to most of our disease problems. If we could just live healthier, and these are lifestyle things, which is at our fingertips. And we all have the ability to take part in that. And I'm not saying that all cancers are preventable, but many of them are, especially hormone-induced cancers like breast cancer and prostate cancer, colon cancer,
Mhm.
and so on. So that's kind of what brought me to the table because I loved that about the American Cancer Society and I loved raising money for them and supporting their programs. And we did lots of trainings and especially for mammography technologists. And then when I retired from that business, there I was with a nonprofit. I had started the CDC program back in 2014. And that's all I had to do. This was my sunset. So my sunset's has got a pretty big bright light for me right now because, mostly I'm understanding and realizing the great importance of what we're doing. It's still early in terms of the United States accepting this program, the medical community primarily, because it takes time for these things to change. The American Medical Association is really promoting our program along with the CDC. Congress passed this act in 2012, making it the National Diabetes Prevention Program Act. It's
Wow.
very active in 25 states in our country right now. It's in our public health department here and in most of the country, almost the majority of the country. So we actually take patients from all over the United States that have fee-for-service Medicare. So it's kind of exciting. We have people from Alaska and Florida and Michigan and New York taking our programs because we're actually doing everything with Zoom. And, the pandemic was a little tough, but
Mhm.
it really changed our lives, didn't it? It was such a huge, huge change. And when the pandemic hit, we sold the furniture and hid under the bed. And I watched on the news and said, 40% of the mortality was people that were diabetic. So then I
Yeah.
said, you know what? It's time to get out there. So I started up a new program with myself in the class. I went for it. And because we were all gaining weight and not working out and everything, and started our first class. And since the pandemic. And since then, we have been doing nothing but our program remotely with Zoom. It's a live class that we do. And it's been successful. We are highly successful. The CDC's program requires that each person agrees to lose 5 to 7% of their body weight in 1 year, and our average weight loss has been 10, 11%. So we're very excited
Wow.
about that.
So I want to talk a little more about the actual program because from what you've shared, it's not just about telling people to eat better or exercise more. It's more about giving them a structured path to change their habits. So for someone who's never heard of the National Diabetes Prevention Program, how would you explain what it is and who it's designed to help?
Well, the eligibility to get into the program is you have to be 18 and you must be overweight. You have to have a BMI of over 25 or 23 if you're Asian. And then you must also be pre-diabetic. And by the definition of pre-diabetes, that means that you have an A1C, which is an average of what your glucose levels have been for the last 3 months. It needs to be 5.7 to 6.4. So anything below that is going to be normal. Anything above that is going to be you're in diabetes. 2 blood tests that show that you're over that, you get an official diagnosis of diabetes, which nobody wants.
No.
And then the only exception to that would be the loophole is if you had gestational diabetes. If you were pregnant and you got diabetes during your pregnancy, you do not have to meet that pre-diabetes blood work. And that blood work, we need to see a copy of it, and it needs to be a year or less. So women that hit diabetes during pregnancy and they need to lose weight can join our program without having to meet that pre-diabetic blood glucose level. And then the glucose level for a fasting glucose, for instance, would be 100 to 125 or 110 to 135 if it's Medicare. Medicare has a little bit different. And then,
Okay.
there's something called a random glucose test, and that means you ate a meal. Which, if you're doing a screening and you're out in the field and we do a finger stick and find out that you're a pre-diabetic, that would be 140 to 199 level. So
Okay.
that's the requirement to get into the program. Each participant must agree to do 150 minutes of moderate to brisk exercise, physical activity per week. And we actually need to see those they have to log those minutes for us, what they did and how long they did it. And they have to turn that in to our lifestyle coach.
Okay.
So the lifestyle
Awesome.
coach pretty much manages the program. They are trained by the CDC. All of our coaches all have master's degrees or bachelor's degrees in public health. And in order for a vision of health, that's what our requirements are. And this really seems to make a big difference because they understand, health education. We are not nutritionists, so we don't pretend to be because we're following the CDC's
Hmm.
curriculum. And they have the curriculum there. And everybody's welcome to look at the curriculum. It's online. You can take a look at it, it's a 1 year long program. And each class, each session is a different topic, and it's a 1 hour Zoom session. And then we'll
Okay.
have 5 to 10 people in each cohort, each class, and it kind of acts like a support group. Each person has to sign a HIPAA agreement because it's all private so that we can
Hmm.
talk about what helps us, what hurts us, and what can we learn from each other to help us achieve our goal. So everybody has a plan and they have a goal of and they can change their plan and their goal as they go along. Some people have a lot of weight to lose. Some people have a few pounds to lose because the research has shown that when we lose weight, our glucose levels start to go down. And so having
Hmm.
them normal. So why is it bad to have high glucose in our blood? Well, unfortunately, too much glucose means that we're eating too much food, and
Yeah.
that's the problem. And, I don't know anybody who doesn't like to eat. So it's a bit of an epidemic in our country. And maybe this is a good time to talk about the numbers because in the United States in 2023, we had 98 million Americans that were pre-diabetic. And in just the last 3 years, it's now 115 million Americans are pre-diabetic.
Wow.
And that's a pretty big number. And that's not to say they're obese because they're not all obese. I think our obesity is even higher. There's a lot of people with obesity that do not have prediabetes.
Hmm.
And that's because either they're very young or very active and they might be eating a fairly healthy diet, but they don't have prediabetes. Probably half of Americans over the age of 65 are pre-diabetic, and that's because we're starting to slow down as we get older. We're not eating maybe as well as we could or as we should, and we're not getting
Mhm.
as much physical activity. Our cells are reproducing at a slower rate, so we're just not at the same level of metabolism as we were when we were younger. I've noticed that certainly with myself.
Oh, yeah, me
It's a
too.
big change. So we really do require and ask each person before they join the program, this used to be a once in a lifetime benefit from Medicare and Medicaid. And just in February, Medicare changed the requirement that now anybody that's pre-diabetic that qualifies for Medicare can receive this benefit as long as they are pre-diabetic. But the good news is that over 58% of people over the age of 50 have full success with this program, meaning they're able to lose weight and keep it off and keep their glucose levels low.
Mhm.
For people age 60 and over, there's a 71% success rate for people that are able to lose enough weight to lower their glucose levels so that they don't get diabetes. And then some people, we just delay the diagnosis of diabetes by such a long time that it's very, very beneficial for taking this class or this program.
Right.
So that's pretty much the requirements to get into the program. And then, of course, some insurances do pay for it. Uh,
Mhm.
there are about 1,500 insurance companies in the United States right now, so some of them actually will pay for the program, which is prevention. This is the only program in the United States that the government pays for prevention, which is kind of exciting and cool because
Yeah.
we're not just preventing diabetes, we're preventing many, many, many different diseases. Because as I mentioned earlier, that glucose level really having too much glucose in our blood, in our body, produces something called inflammation. And everybody's kind of heard about inflammation and the damage that it causes our body. So, yes, eventually inflammation will cause diabetes, but it also causes heart disease, which is the number one killer of human beings on the planet. Heart disease. So, preventing heart disease is really a major, major benefit of following this lifestyle change program. The next would be cancer. The cancer and the cardiac disease the statistics are almost identical. They're pretty high. And then, of course, things like stroke and then diabetes and down the line. So we can prevent many diseases just by making these lifestyle changes. But, a whole lifetime of bad habits can be tricky, and that's what we're
Mhm.
basically trying to do is we're trying to trick people into getting rid of those old habits. And the best way
Yeah.
for us to do that is over a period of time. And so we know the research has shown the longer that we practice a new habit, the better chance we have of maintaining that habit. But with food, it is a little more tricky and it's a little more difficult. And that's the reason why they've allowed this program to go on for a year. Because a lot of people go, oh my God, a year is a really long time. But the first 6 months, we do 16 1 hour Zoom sessions. And we talk about things like, what's on my plate. We follow the American Diabetes plate. And how much protein should we get in a day? What are the good fats, the bad fats, the good carbs, the bad carbs? So we tell you what will help you, what will hurt you, and what won't hurt you.
That's great.
And then how do we make sure that people are following this? Well, we do have a lot of accountability built into this program, which I believe is the reason why this program is so highly successful, is because it is required that each participant must send us a picture of their scales before we meet each session. So
That accountability
it
is important.
really does make a difference. And if you're going to be sending that picture in, it does have an effect
Yeah.
on you in terms of how you behave before you send that in, because
Right.
you just can't cheat that. That's something,
No.
it's impossible to cheat, although some people just don't send it in. we have to deal with that in terms of trying to help
Right.
people. And usually the group itself, if everybody's turning it in, you don't want to be the one that didn't, right?
Right.
And everybody,
Yeah, that group help.
something to talk about. That's what the whole point of
Mhm.
of this being a support
Right.
group. So our coach will lead that session, whether it's talking about, how do I eat well at a party? How do I eat well when I'm on vacation? How do I get enough exercise every day? Do I need to partner up with somebody? Do I need to join the gym? Do I have bad joints? Do I need to maybe swim for my exercise or find a special treadmill where that you can jump up into a suit
Mhm.
and you can get your heart going and get burning fat without hurting your joints? So there's lots of different things. I mean, we've all between the group, everybody's pretty much tried everything. I know I have. I've been involved in every single weight loss program known to man.
Debbie, let me ask you a question. I have a Sam Billimoria trying to get in. Do you want him to show up on the podcast and speak?
Sure. Yeah, Sam is
Okay.
our lifestyle coach, and he's our
Okay.
master coach. He has an
Okay.
he has an MBA from UCLA in business and an MPH, a master's in public health from Cal State Northridge University. And he is the one that gives these very high marks for weight loss.
Okay. Awesome. All right. Let's see if Sam can join us. Hi, Sam. How are you?
I'm good. I'm good. Thank you for letting
Awesome.
me in.
Yeah, absolutely. I was waiting for a break there. Debbie was going into some specifics about the program, but we'd love to hear a little bit from your perspective.
Which program are you talking about?
I am talking about the program with Debbie.
The National
Now it's lost
Diabetes
me.
Prevention Program.
A vision of health, the National Diabetes Prevention Program.
Oh, yes, the National Diabetes Prevention Program. I'm sure that Debbie has given you all the statistics, and it
Hmm.
is what I feel is absolute unawareness. The awareness of this particular problem is not there. I think that is the main thing of which we are approaching the legislatures. I'm sure she has told you about it. Then secondly, even if the awareness is there in a very limited space as about 10%, those 10% of the people are having a problem getting reimbursement from the insurance companies. So here is everything that is kind of bunched up. One
Hmm.
is 115 million people, as you know, have got pre-diabetes, 90% are unaware, plus 40% have diabetes, and of that, probably one-fourth are unaware again. So you have a total cumulative demographic of 155 million people, which is 44% of the population.
Hmm.
I would submit to you that there is no population as vast as this in this specific space of a pandemic, right? Now,
Hmm.
given that there is absolute apathy on the on from the legislative side to give it a little bit of more traction. I'm sure that Debbie has explained to you how she got the mammography done and got the legislative traction in it. So we require a similar traction in this particular case, which is runaway. And I'm sure she has told you that given the the pre-pandemic coalition, like it was only about like 96 million people, and now it has risen to 115 million people.
Wow.
And the CDC is not updating that specific statistics, if you will.
Very interesting. Yeah,
Now,
those are some
now,
interesting numbers.
another thing, please keep in mind. You know how much the insurance companies are spending on this?
No, how much?
What if I told you it's hundreds of billions?
I would believe that.
It's the CDC later. I mean, every time I read up a statistics, it's going up by a couple of $1 billion. Read, I honestly, I just read it last month that it was like 409 billion. Today I pick it up and it says 413 billion.
Wow.
$10 billion spent
Yeah.
on medication of diabetes. 61% of that goes to Medicare, and a lot of it is taxpayers' money.
Hmm.
I don't know how many billions. I cannot, give the arithmetic proportion of that, but it's in hundreds of billions of dollars. Medicare is taxpayers' money.
Hmm.
So now you can see the volume and the real spectrum of the problem that we are having there. there is no kind of legislative teeth in getting reimbursed, which is the main thing. We are
Hmm.
facing problems in recruitment, which again, to say the least, is from the medical providers side. I can give it as broad spectrum, specifically the physicians. And we are in a sea of this uncharted waters, trying to make our way to make a destination, if you will.
Good point, Sam. Yeah, that's so true. And I talked about the numbers of pre-diabetics. When I was doing mobile mammography back in 1988, 5% of women were getting their mammograms done. And in 1995, California passed a law saying that every insurance company must pay for a screening mammogram. And when I retired from that business in 2018, 78% of women were getting their mammograms. So it took a law. And lately, Sam and I have been going out and meeting with all of our government officials, both federal and state, to let them know about the program because most people don't even know about the program. And they should really be letting their constituents know about this program. But I think we're going to need some boosting and some help with some legislation to make this happen. So I just wanted to mention that because Sam brought that point up, and it's a very good point that we should probably start working along this line. Because, like in states like Pennsylvania, 68% of the people enrolled in that program were referred by a physician. In California, it's 6%. So, and
Hmm.
Medicare actually will give a raise to physicians, 5, 6, 7% raise in income if they screen 60% of their population for pre-diabetes. So they're trying to promote. And the CDC can't get political, so they told us that we need to go knock on the doors of our government officials, which Sam and I have done. We've met with 7 of them just in the last month. So we're beating down the door, basically, really trying to get this program off the ground. And thank you, Sam. You've done his contacts has been amazing. We really trying to hit it hard.
Awesome. So let's talk. I'm sorry. Did you have something, Sam? Did you
Well,
start?
here's the thing, though,
Sure.
the point is, I also met with a U.S. Senator office yesterday, and we are also okay. We have to meet with 2 other senators, Debbie, when you come back. So let me know the dates. I have to book the senator like 60 days in advance because they are really booked. Or probably we'll just have an audience with his field officer, which I talked to yesterday. I went for the other thing, as you know. That was my aim. And I'm busy doing a very big community project for my own. That is the context that I have through those projects.
Mm. That's awesome. So we've talked a little bit about the program itself and then some of the legislative implications and as well as how this is kind of affecting us on a higher, more global financial scale. Let's talk a little bit about your actual your operations within your program. So from an operational standpoint, what does it take to run a vision of health and keep this program moving consistently?
Well, I think probably you're looking at Sam is really probably one of the most important aspects of this program. We're a very small nonprofit, but we do happen to have a very vibrant internship program with Cal State Northridge University, CSUN, and with Cal State LA, which is my alma mater. And we have these in public health and we have them in health administration. I guess you could say that a vision of health is kind of an intern led organization. We're out there doing tabling. We're working with insurance companies trying to get paid. We have to submit data. Every single scale, weight, and every minute of exercise has to be reported back to the CDC twice a year. And if our participants don't lose weight, they will take our recognition away and we won't be able to do this anymore. So we've been doing this very successfully since 2014. So we feel that that's important to maintain all of that and so we have credibility. And I think that our board of directors is really important too. We have a PhD in public health, Dr. Kathleen Young and Dr. Stacy Brown Mizakasa. And Sam is on our board, and we have Nestor Ariano, who is a NPH from Cal State LA, and he's also a coach, and he speaks Spanish. So we are doing these programs in Spanish. We have a couple of 2, 3 coaches that are bilingual in Spanish. And a lot of these interns
Awesome.
do speak other languages like Armenian and Thai and Vietnamese. I do encourage them during their internship to reach out to their community, to their churches and to their schools and promote this program. And we've been able to like go on Armenian TV and set up a screening at a local a private religious school,
Nice.
which is exciting to be able to do, to be able to reach that population that normally wouldn't be able to be reached. So I would say that, doing the CDC submissions, it's a little bit tricky, and it's really good for healthcare administration interns to learn how to do this, to learn how the insurance industry works, because so many insurances won't pay for this. So we have to, get on the
Right.
phone, and we have to get involved with them and trying to get contracts with them. And that's really the plight of what we're going through right now, because usually when Medicare starts doing a program, the other insurance companies kind of fall in line. Well, this has been taking, 2012. It's been a while. So we
Mhm.
really kind of need to speed this up and try to get the insurance companies more on board. Obviously, the insurance companies are going to be making more money down the road if there's less disease. But today, the bean counters are looking at each bean that comes out today. So there's an outlay of costs. And we bill, it's a monthly billing that we go through. The billing company that we use was granted to us from the CDC so that we have, good coverage for doing billing. But we get denied an awful lot. Almost, I would say 40% of everything we bill gets denied. So we're banging on that door too. And that's the reason why we have we're trying to get legislative support and help with that also. And, back in the day, back in the late 80s, when I was starting in my other practice, we marketed to women because doctors were not ordering mammograms on their patients. So that's kind of what we're doing right now. We're marketing to the individual participant. And we're doing that by going to health fairs, farmers markets. We will table anywhere. And we're trying to set up some pop-ups, for screening. We started our program by going to the parent centers and at the elementary schools in Los Angeles. And that's how we got our very first class put together. So finding participants that are willing to get into this program is where we spend most of our time and our energy with this program. So that's basically how we're pretty much running. We are a nonprofit. So we do fundraisers, of course, which can be an expensive thing to put together. But we'll have 3 or 4 different fundraising opportunities going on all throughout. So that's pretty much what the nonprofit side of A Vision of Health is doing to support this program. And we
Okay.
love this program, Nancy, as you can tell.
Yeah, absolutely. So, what kind of system or processes do you have in place to bring in these new partnerships or new interns or new opportunities to get in front of people? And then also on the system side, what kind of system or data tracking do you have so that you're really able to show that ROI to insurance companies for people who have been through your program and the cost savings for an insurance company in order to propel that legislation
Well,
forward
all
and
yes.
those
All of our stuff
relationships?
is actually in a portal called Weld, and this is a portal that keeps track of everything, all the money coming in, all the weights, watching the A1C come down. So we're able to show all that. So everything is in that portal, which is awesome. And that way we can do reports. We pull up ROI. We can pull up anything that we need to from that portal. Everything is in that portal. And that's mostly where we spend most of our time, especially with health administration, teaching them how to use that portal and recruiting because we can send out letters from there. But the recruiting is tough because, we have a website and people, say that they want information and then we can't, and then they, in the middle of the night, it sounds like a great idea, but during the day, they're like, oh, they're too busy for that. And they don't return our phone calls. So we get a lot of ghosting with that for people that reach out to us. And when we try to reach back to them, we're ghosted. So that's kind of typical, I guess. I'm sure I've done the same thing many times when I thought, oh, this seems like a really great idea. I think I'm going to do that. And then the next day it's like, it's a big commitment. It
Yeah.
is, and it's a big commitment. That's why we spend a lot of time trying to promote and explain the program because it is kind of a complicated program. I mean, we're going to be talking about things like sleep. We're talking about things like how do I turn negative, unhealthy thoughts into positive thoughts? We're talking about partnering up with our
Right.
support group and with our family. A lot of our participants don't even tell their family that they're in this program. And so when they go to the family reunion, they eat like they always used to eat because they haven't even shared that. So that's one of the things that we really are trying to get them to make that change. We used to call this
Mm,
program the New Leaf program, turning over a new leaf idea.
right.
And that's really what it's about, trying to turn over a new leaf because especially with adults towards the end of their life, they're mature, they understand that this is kind of their last chance to really make a big difference in their mobility and their health. And I think that's why they are so highly successful.
Awesome. So, preventative health is becoming a bigger conversation, especially as chronic disease rates continue to impact families and communities, even employers, and the healthcare system, as we were talking about. As technology and virtual programs, remote coaching, and even AI continue to grow, where do you see the most opportunity in prevention? And where do you think the human touch and that connection really matters
Well,
still the
we've
most?
noticed, and I will mention that there's an organization called the Skinny Jean Project that is contracted with the CDC, and we ourselves are in a class or in a cohort to learn how to do all these things to promote more and so on. So one of the things that we're working on right now is an impact statement, for instance, and talking about not just preventing diabetes, but preventing cancer and other things through this program. So that's what we're trying very hard to focus on the important, trying to, you know, organize ourselves so that we can do the ABC of focusing because it's kind of hard, especially, when you have a lot of interns, they're kind of like our children in a way, but they're smart, they're young, and they know AI. So, and we're writing grants too, and we're trying to get to do some research because what better way to do research than with our program because we're documented. I forgot to mention that we do food logs and we look at see what people are eating and what they like to eat. And it's very important for people to understand that they're not going to lose their ability to enjoy their food. They're going to be able to try more foods. And what we're pushing plants right now, of course, because we understand that the gut biome is the ruler of our body pretty much, and that we have to keep our gut happy. And the best way to keep our gut happy is with proper nutrition of plants. And plants and protein goes along with it too. We have to have enough protein in order to power up, but we definitely need to keep our gut happy. And plants seem to be the way to do that. And so that's one of the things that is a change for many people, like fiber, for instance. Fiber is a big thing. We didn't talk about GLP, but the GLP business is booming right now. It's a very big thing. And I would love to be involved with some research with that. But I don't know how long and what's going to happen with GLP. But our program is tried and true. It works. And it would be wonderful if we could find participants that were interested in a GLP, but start with this program at the beginning when they are pre-diabetic. And then when they get to the end of a year, they should be able to carry on without the drug because 75% of
Hmm.
people that are on GLP will gain all of their weight back when they stop if they have not made a lifestyle change. And this seems to be the thing. If you think about it, when you're on the GLP, you don't feel like eating because your peristalsis is slowed down. So you're not eating all the time. But the big problem that people are having is that they're not eating the foods that they should be eating. They're eating what they crave. They're eating the same thing that they were eating before, but they're eating less of it, which is making them
Right.
sicker because they're not getting enough fiber. They're not getting enough plants.
Protein.
Okay. So
Yeah.
that's really where the big issue is. So I think taking this program at the beginning of their journey would allow them for much greater success at the end because you just have to make that lifestyle change. You can't fake it. And I think, that CDC, the whole country, the whole world is up with GLP, but we have to really flip this health side. We have to eat better. There's just no way out of that. And it would be really great if we could lose weight and eat well. That's the thing. Rather than eating the same junk that we were eating before, now we just eat less junk and we lose weight, but then we're stuck with a gut biome that is very unhappy. And then the minute that you're off of the drug, boom, you're back with it all. So that's what's going on right now.
Yeah. All right, that was a beautiful explanation, and I agree with you that when you're utilizing a GLP-1, you really have to be cognizant of what you're putting in your body, making sure that you're meeting those protein requirements and also getting those vegetables and that fiber in. Otherwise, you're going to start to have some of those things that we're seeing, such as, lowered bone density and reduced muscle mass and hair loss. So,
Oh, yeah,
I think,
huge. It's just such a big
yeah.
thing. And I mean, we could talk about this all night. And most of the country is talking about this right now, but I haven't heard it quite said this way. But I've heard enough people talking about this that I'm really starting to begin to understand that's the reason why they gained the weight back is because they didn't change what they were eating. If you can change what you're eating when you're starting, then you can have great success with this. And it is a total miracle. It's a wonderful thing
Mhm.
to be able to lose weight. But remember, it's easy to lose weight. It's really hard to keep it off. And that's really what this is about. This is not so much about the losing of the weight. It's really about keeping the weight off. And that's the reason why people like Sam, who is very firm, but very compassionate about helping people get through that process. Because it's tough. It's a really hard one because eating is it's one of the few pleasures that we have in life, and it's one of the things that we control. We get to say what we eat, and giving that up by having to do a food log or a food diary is very difficult for some people to do. Sometimes we just have to interview them because they won't tell us because we really want to see what people like so we can help them make that transition. And so we have our interns, they go through and they circle the things that maybe weren't the greatest idea and then make a recommendation on maybe what they could have had instead. And that helps them because remember, this is not a diet. This is people can eat what they want to eat. Some people I've met them, they eat red meat 3 times a day, 7 days a week. And I'm going like, well, you're going to be able to eat red meat, but I don't think you're going to want to be eating that much red meat. That's just too much. So we lay it all out for them, but it's their decision what to do or what to eat. So that's kind of the one of the major benefits of this program is it is not a diet. This is
Mhm.
really, you eat what you believe is the best thing for you to be eating, but we want to be sure that you love what you're eating. And therefore, we're really pushing, have you tried, different mushrooms, King's, mushrooms. There's just so many things that you and I haven't even tried yet that are out there that we need to explore, and they're good for us and they're healthy for us. So that's what we're about, the lifestyle change. That's the bottom line. Even though GLP is on the rise, I don't know how long it's going to be here, but it is a miracle. But we just feel that it's half a miracle.
Right. Yeah, it only gets you so far if you're not treating the root cause of how people are eating. So, all right, Debbie, Sam, we're going to do a quick lightning round before we kind of sign off. So these are quick questions and short answers. So what is one myth about diabetes prevention that you would love to eliminate? And either of you can answer. Just jump in.
Sam?
It's mainly the awareness of that particular pandemic that is going on, and we need more awareness.
People don't know, but 90% don't know they have it. That's crazy.
Yeah. So it's just not even knowing. Yeah. Okay. What is one small habit, and I'd love if both of you could answer this one. What is one small habit that can make a big difference in someone's health?
Take small
Knowing what their glucose level is. Number one, just finding out what their glucose level is. Go ahead, Sam.
no go no I was going to say take small steps in improving your lifestyle change. So as Debbie said, the glucose level is there. It takes a little time for it to get used to the new metabolism. But however, you can take small steps. And what I try to do is that I give them a big picture and then put it down to a minimum. So if they are going to lose 10 pounds in 6 months, I say all you have to do is lose half a pound a week. And that really helps them to focus on the present.
That's great. I like that. And I agree on both of those. You have to have those small lifestyle changes and really take it one step at a time. And I've also found that it's been very helpful for me when I'm wearing like a glucose monitor to really see immediate food feedback on, okay, how is this affecting my glucose level, my insulin level? So I think those are great ones. And then this last one's very easy. It's just, how can people learn more about a vision of health or connect with you, whether they want to be a part of the program or they're interested in maybe donating?
Visionofhealth.org is our website. People can also find out where there is a CDC program near them by just going to the CDC's registry of National Diabetes Prevention Programs. Just Google that and you'll get a list. You put your zip code in there and you'll get a list of all the providers that are close to you in your area. And since we do take our Medicare participants anywhere in the United States, so, look at that registry and you can find in-person classes and in different languages. And the CDC is, they did the research, they found this program, they developed it, and it's a winning program.
Awesome. All right. Well, we will include those links in our show notes. So, Debbie and Sam, thank you so much for being here and sharing your work behind A Vision of Health. What I really appreciate about your story and the story of how A Vision of Health has really come into its own is how it's been decades in the works, right? So your work has always been preventative led, and I love that it's taken you where you are now in this space.
Thank you, Nancy.
From mobile mammography to breast cancer prevention, all the way to diabetes prevention. There's a clear thread in your work, and so you're really helping people understand their risks and access that support that they need to make those changes before a health crisis takes over. And I really appreciate, Sam, your passion, and you're obviously a numbers guy. So hitting us with the numbers, I think that's such a powerful position to take, because it really gives people a perspective of just the extensiveness of this pandemic and how it's affecting us, not only on a health level, but also on a fiscal level. So for anyone listening, you can learn more about Debbie and Sam and A Vision of Health at avisionofhealth.org. We will include a link to that in our show notes. And as we always say on the Practice Pulse, innovation creates possibility, implementation turns it into growth. If you'd like to learn more about innovations in health, wellness, and the longevity space, and how these businesses are growing, make sure to like and subscribe to the Practice Pulse. We will see you next time.
Thank you.